Carotid Health Agency.
He is not connected with or endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency.
Medicare won't be providing free health care someday. It will cover the bulk of the health care costs for people 65 or older who have disability, and there are programs to help cover the rest of the costs for low income. But for most of us, be prepared to pay a few $1,000s in a year in out-of-pocket costs, unlike the costs that we experience on an unemployed plan. We will go over option costs, precisely how much that depends on your Medicare coverage choices, your health care, in some cases where you live, and here's your guide on those costs might look like for both choices for Medicare Original or Advantage or Supplemental. 1. If you get admitted to the hospital, Medicare Part A covers hospital stays. There are no monthly premiums for most enrollees, but still expect some big bills if admitted. Original Medicare. There's a deductible. That is the amount you must pay before coverage starts for each hospital stay. For 2023, is a $1,600 day for days 1 through 60, and $400 per day for 61 through 90, and $800 per day for days 91 through 150. With a Medicare policy, you usually cover that cost. After deductible, most costs are covered. Medicare Advantage MA plans generally levy a per day copayment for hospital stays. The amount varies by plan. 2. Out-of-pocket limit. Annual spending cap to prevent an illness or injury from devastating your finances. Medicare has two approaches to this. Original Medicare. Part A and Part B, no caps, but Medigap plans K or L policies cover all costs after a certain threshold. Part D, a new law placed a $2,000 annual cap drug cost effective in 2025. Medicare Advantage. The federal government sets an out-of-pocket cap for these plans, $8,300 in 2023 index services, and a total of $12,450 for all in and out-of-network service combined. 3. If you need a doctor, the two possible costs are co-insurance, a percentage of the total doctor visit cost, or a copay, a upfront fee, often paid upon arrival. Original Medicare. No copay, but expect a bill for 20% of the cost of the doctor visit after you have met your annual deductible, which is $226 in 2023. If you have a Medigap policy, it's generally paid part or all of the 20%. For a Medicare Advantage plan, depending on your plan, you will likely pay either a flat copay for seeing a doctor, $20 per visit is not uncommon, or percentage of the bill. You will pay less overall if you see your doctor who are part of your plan's network versus an out-of-network doctor. 4. Ongoing enrollment costs. Even if you never see a doctor, get a test, or go to the hospital, you must pay a monthly premium to be part of the Medicare program. Original Medicare. Part A is premium free if you worked it long enough, typically 40 quarters. If you are not, premium in 2003 is up to $506. Part B monthly premium is $164.90. In 2023, more if your income is high. Part D drug plans premium vary, but 2023 national monthly average is $32.74. Medicare Advantage. If you enroll in a private insurance MA plan, you are still responsible for the standard Part B premium of $164.90 in 2023. Many plans levy another premium. The average 2023 average premium is $18 per month. MA plans usually cover drug costs without an extra premium. 5. If you need medicine. While Medicare Part D plans cover most classes of medicines, each has a unique formulary or list of specific drugs it will cover. Original Medicare. You must enroll in a private party plans to get drug coverage premiums vary, but the national average is $32.74 a month in 2023. Co-pays and co-insurance also vary by plan. Medicare Advantage. Most plans bundle their medical and prescription drug coverage and don't have a separate premium for medicine. The rules of prescription drug coverage vary by plan. 6. If you have an emergency, Medicare will cover most of the cost of a sudden health issue, including most ambulance rides, if you are within the United States. Original Medicare. You will likely pay a copay for an ER visit. The amount will vary depending on the service you get. You'll also have to cover 20% of the doctor's service. But if you are getting admitted to the hospital, Part A prices would apply. Medicare Advantage. Plans are required to cover emergency room visits just like the original Medicare does, but how much you have to pay is less predictable. It will vary by plan you choose and emergency you suffer. Help in affording Medicare. Those with limited income may qualify for Medicare savings programs that can help cover your out-of-pocket costs. Each is funded by the federal government but run by the state Medicaid program, which means criteria may vary depending on where you live. 1. The Qualified Medicare Beneficiaries (QMB) program help pay for Part A and Part B premiums, as well as deductibles, co-insurance, and co-pays. This program has the lowest income threshold of the four. 2. Specified Low-Income Medicare Beneficiary (SLB) program help pay only for Part B premium. It is useful if your income is too high for QMB aid. You also automatically qualify for extra help with drug costs. 3. Qualified Individual QI program also helps only with Part B premiums. If your income is too high for QMB and SLMB, you might qualify for, but funding is limited, provided first come, first served. 4. Qualified Disabled and Working Individual QDWI program only helps pay for Part A premiums. This program is designed for individuals with disabilities who are younger than 65 and currently working. For a free consultation, go to www.camaraderiehealthagency.com.
We invite you to follow us on Facebook, LinkedIn, Instagram, YouTube, and Twitter.